When you hear the word hero, what comes to mind? Maybe Superman catching a person falling from a building, or possibly leotards in capes. Anyone can be a hero and save a life if they recognize early signs of stroke or heart attack and take appropriate action. By applying what you learned today, you could even save your own life by taking preventative measures for high-risk conditions. We have all heard of stroke and heart attack, but why is this training important to you and those around you? Here are some facts about stroke in the United States. In 2018, 1 in every 6 deaths from cardiovascular disease was due to stroke. Stroke is a leading cause of serious long-term disability. Stroke reduces mobility in more than half of stroke survivors age 65 and over. Stroke is a leading cause of death in men, killing almost the same number of men each year as prostate cancer and Alzheimer's disease combined. High blood pressure, high cholesterol, smoking, obesity, and diabetes are the leading causes of stroke. 1 in 3 U.S. adults has at least one of these conditions or habits. Heart attacks are just as prevalent in the U.S. These are some eye-opening figures. As of 2018, 30.3 million U.S. adults were diagnosed with heart disease. Every year, about 647,000 people die from heart disease, making it the leading cause of death in the United States. Heart disease causes 1 out of every 4 deaths. According to the American Heart Association, 26% of women will die within a year of a heart attack compared to 19% of men. By 5 years after a heart attack, almost 50% of women die, develop heart failure, or have a stroke compared to 36% of men. These numbers can be scary or intimidating. However, they are also a good reminder of how important it is to know about heart attack and stroke. The best defense you have against these supervillains, cerebral slicer and cardio crippler is...
Okay. I know you want to be creative, but let's keep it to the original script. Take 2 in 3, 2, 1.
The best defense you have is knowledge, so let's jump right in. It may seem odd to talk about these two topics together, but both are caused by lack of blood flow, which delivers oxygen to the critical parts of your body, your brain or heart, and the preventative measures for both are the same. In greater detail, we are going to cover what they are, signs and symptoms, who is at risk, prevention, how they are diagnosed, and treatment. And then you can be the unstoppable oxygenator.
Okay, oxygenator, that's pretty creative too, but let's keep it to the original script.
A stroke, sometimes called a brain attack, happens when blood flow to part of the brain is blocked or when a blood vessel in the brain bursts. Blood carries oxygen to cells in the body. When brain cells are starved of blood, they die. A stroke can cause lasting brain damage, long-term disability, or even death. To understand stroke, it helps to understand the brain. The brain controls our movements, stores our memories, and is the source of our thoughts, emotions, and language. The brain also controls many functions of the body, like breathing and digestion. An ischemic stroke occurs when blood clots or other particles block the blood vessels to the brain. Fatty deposits called plaque can also cause blockages by building up in the blood vessels. 87% of strokes are ischemic strokes. A hemorrhagic stroke occurs when a blood vessel leaks blood or a blood vessel bursts in the brain. Blood builds up and puts too much pressure on brain cells, which damages them. Transient ischemic attack, or TIA, is sometimes called a mini-stroke and is a warning sign of a future stroke. Recognizing and treating a TIA can lower the risk of a major stroke. If you have a TIA, your healthcare team can find the cause and take steps to prevent a major stroke. More than a third of people who have a TIA and don't get treatment have a major stroke within 1 year. As many as 10 to 15% of people will have a major stroke within 3 months of a TIA. By knowing the signs and symptoms of stroke, you can take quick action and perhaps save a life, maybe even your own. Here you see the most common symptoms to be on the lookout for. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble with speaking or difficulty understanding speech. Sudden problems with seeing in one or both eyes. Sudden trouble with walking, dizziness, loss of balance, or lack of coordination. Sudden severe headache with no known cause. Call 911 right away if you or someone else has any of these symptoms. Acting fast can help stroke patients get the treatments they desperately need. The stroke treatments that work best are available only if the stroke is recognized and diagnosed within 3 hours of the first symptoms. Stroke patients may not be eligible for these if they don't arrive at the hospital in time. If you think someone may be having a stroke, act fast, use this acronym, and do the following simple test. F. Face. Ask the person to smile. Does one side of the face droop? A. Arms. Ask the person to raise both arms. Does one arm drift downward? S. Speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T. Time. If you see any of these signs, call 911 right away. Note the time when any symptoms first appear. This information helps healthcare providers determine the best treatment. Do not drive to the hospital or let someone else drive you. Call an ambulance so first responders may be able to start your treatment right away and can alert the hospital that a stroke patient is on the way. This notification gives the hospital's medical team time to prepare equipment and medicines you may need. If your symptoms go away after a few minutes, you may have had a transient ischemic attack or TIA. Although brief, a TIA is a sign of a serious condition that will not go away without medical help. People who have high blood pressure, high cholesterol, and diabetes are at higher risk for stroke than those without these conditions. High blood pressure is the leading cause of stroke. Extra cholesterol can build up in the arteries, including those of the brain. This can lead to narrowing of the arteries, stroke, and other problems. Diabetes causes sugars to build up in the blood, replacing and preventing oxygen and nutrients from getting to the various parts of your body, including your brain. Additional risk factors include a person who has sickle cell disease, a blood disorder, linked to ischemic stroke that affects mainly Black and Hispanic children. The disease causes some red blood cells to form an abnormal shape. A stroke can happen if sickle cells get stuck in a blood vessel and block the flow of blood to the brain. You can't change your family's health history, but knowing can help you reduce your risk by taking preventative steps. Genetics play a role in high blood pressure, stroke, and other related conditions. Several genetic disorders can cause a stroke, including sickle cell disease. People with a family history of stroke are also likely to share common environments and other potential factors that increase their risk. The older you are, the more likely you are to have a stroke. The chance of having a stroke doubles approximately every 10 years after 55. Although stroke is common among older adults, many people younger than 65 also have strokes. What, you may ask, can you do to prevent stroke? The answer is know your ABCs of heart and brain health. A. Aspirin. Aspirin may help reduce your risk for stroke. Before taking aspirin, talk with your doctor about whether it is right for you. B. Blood pressure. Control your blood pressure with healthy lifestyle changes and possibly medication prescribed by your doctor. C. Cholesterol. Manage your blood cholesterol with healthy lifestyle changes. If a cholesterol medicine is prescribed, take it as directed. S. Smoking. Don't start smoking. If you do smoke, learn how to quit. Many strokes, it's estimated 80%, could be prevented through healthy lifestyle changes and working with your healthcare team to control health conditions that raise your risk for stroke. Additional ways to prevent stroke include the following. Choosing healthy meal and snack options such as fresh fruits and vegetables. Eating foods low in saturated fats, trans fat, and cholesterol and high in fiber. Limiting salt in your diet. Being overweight or obese increases your risk for stroke. If you know your weight and height, you can calculate your BMI at the CDC's Assessing Your Weight website. Physical activity can help you stay at a healthy weight and lower your cholesterol and blood pressure levels. The Surgeon General recommends 2 hours and 30 minutes of moderate intensity aerobic activity, such as a brisk walk, each week. I know we have touched on this already. It is worth repeating. Cigarette smoking greatly increases your chances of having a stroke. If you don't smoke, don't start. If you do smoke, quitting will lower your risk for stroke. Your doctor can suggest ways to help you quit. Avoid drinking too much alcohol, which can raise your blood pressure. Men should have no more than 2 drinks per day, and women only 1. Things will move quickly once you get to the hospital, as your emergency team tries to determine what type of stroke you're having. That means you'll have a CT scan or other imaging test soon after arrival. Doctors also need to rule out other possible causes of your symptoms, such as a brain tumor or a drug reaction. Some of the tests you may have include a physical exam, such as listening to your heart and checking your blood pressure. You'll also have a neurological exam to see how a potential stroke is affecting your nervous system. Blood tests, to check how fast your blood clots, whether your blood sugar is too high or low, and whether you have an infection. Painless imaging, such as computerized tomography scan, CT, magnetic resonance imaging, MRI, carotid ultrasound, or echocardiogram. To treat an ischemic stroke, doctors must quickly restore blood flow to your brain. Emergency IV medication may be given to break up the clot, but it has to be given within 4.5 hours from when symptoms first started. There are several emergency procedures they could also perform. Medications could be delivered directly into the brain. Doctors would insert a long thin tube, called a catheter, through an artery in your groin, and thread it to your brain to deliver the medication directly where the stroke is happening. Doctors can use a device attached to a catheter to directly remove the clot from the blocked blood vessel in your brain. To decrease your risk of having another stroke, your doctor may recommend a procedure to open an artery that's narrowed by plaque. This can be accomplished by removing the plaque blocking the artery or by placing a stent to open the artery wider. Emergency treatment of a hemorrhagic stroke focuses on controlling the bleeding and reducing pressure in your brain caused by the excess fluid. Treatment options include emergency measures. If you take blood-thinning medications to prevent blood clots, you may be given drugs or transfusions of blood products to counteract the blood thinners' effects. You may also be given drugs to lower the pressure in your brain to prevent spasms in your blood vessels and prevent seizures. Surgery. If the area of bleeding is large, your doctor may perform surgery to remove the blood and relieve pressure on your brain. Surgery may also be used to repair blood vessel problems associated with hemorrhagic strokes. Most stroke survivors go through a rehabilitation program. Rehabilitation may begin before you leave the hospital. After discharge, you might continue your program in a rehabilitation unit of the same hospital, another rehabilitation unit, a skilled nursing facility, or at home. Every person's stroke recovery is different. Depending on your condition, your treatment team may include the following: a doctor trained in brain conditions, neurologist; a rehabilitation doctor, physiatrist; a rehabilitation nurse; a dietitian; a physical therapist; an occupational therapist; a recreational therapist; a speech pathologist; a social worker or case manager; a psychologist or psychiatrist; and/or a chaplain. A stroke is a life-changing event that can affect your emotional well-being as much as your physical function. You may sometimes feel helpless, frustrated, depressed, or apathetic. Maintaining your self-esteem, connections to others, and interest in the world are essential parts of your recovery. Several strategies may help you and your caregivers, including: don't be hard on yourself. Accept that physical and emotional recovery will involve tough work and that it will take time. Aim for a new normal and celebrate your progress. Allow time for rest. Join a support group. Meeting with others who are coping with a stroke lets you get out and share experiences, exchange information, and build new friendships. Let friends and family know what you need. People may want to help, but they may not know what to do. Let them know how they can help, such as bringing over a meal, swinging by to smile and talk with you, or attending social events or religious activities with you. Problems with your speech and language can be especially frustrating. Surviving a stroke makes you a hero too. Be strong, overcome, and recover. Here are some tips to help you and your caregivers cope with communication challenges. Practice. Try to have a conversation at least once a day. It will help you learn what works best for you. It will also help you feel connected and help rebuild your confidence. Relax and take your time. Talking may be easiest and most enjoyable in a relaxing situation when you're not rushed. Some stroke survivors find that after dinner is a good time. Say it your way. When you're recovering from a stroke, you may need to use fewer words, rely on gestures, or use your tone of voice to communicate. Use props and communication aids. You may find it helpful to use cue cards showing frequently used words or pictures of close friends and family members, a favorite television show, the bathroom, or other regular wants and needs. Imagine what it would be like to know what you want to say and are unable to say it. Imagine how hard it would be to lose most of the movement on one side of your body. People have described post-stroke life as being trapped in a body that won't function. Think about how frustrating that would be. Recovering from a stroke can create a wide range of emotions. If you are taking care of someone who has had a stroke, take conversations and movement at their speed. Patience is key. Always let them finish their sentences, even if you know what they are trying to say. Encourage them in all things, but also realize when they need to take a break and rest.
Okay, that looks like one supervillain down and one to go. Let's try and remain focused. Next section, please.
Your heart muscle needs oxygen to survive. A heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. Like an ischemic stroke, arteries that supply the heart muscle with blood flow can become narrowed from a buildup of fat, cholesterol, and other substances that together are called plaque. When plaque within a heart artery breaks, a blood clot forms around the plaque. This blood clot can block the blood flow through the artery to the heart muscle, resulting in the heart muscle being starved for oxygen and nutrients. When damage or death of part of the heart muscle occurs, it's called a heart attack. Two other less common reasons for a heart attack include a coronary artery contracts or goes into spasm. When this happens, the artery narrows and blood flow to part of the heart muscle decreases or stops. The causes of spasms are unclear. Another rare cause of heart attack is spontaneous coronary artery dissection, which is tearing of the coronary artery wall, similar to a hemorrhagic stroke. When a heart attack occurs, the heart muscle that has lost blood supply begins to suffer injury. The amount of damage to the heart muscle depends on the size of the area supplied by the blocked artery and the time between injury and treatment. Heart muscle damaged by a heart attack heals by forming scar tissue. It usually takes several weeks for your heart muscle to heal. The length of time depends on the extent of your injury and your own rate of healing. Even though a part of it may have been severely injured, the rest of the heart keeps working. But because of the damage, your heart may be weakened and unable to pump as much blood as usual. Is all chest pain a heart attack? No. One very common type of chest pain is called angina. It's a recurring discomfort that usually lasts only a few minutes. It occurs when your heart muscle doesn't get the blood supply and oxygen that it needs. There are different types, including one type often occurs during exercise or emotional stress when your heart rate and blood pressure increase and your heart muscle needs more oxygen. The other type occurs while you may be resting or sleeping, or with little physical exertion. It comes as a surprise and can lead to a heart attack, and it should be treated as an emergency. Despite its name, heartburn, or acid indigestion, is related to your esophagus. But because the esophagus and heart are located near each other, either one can cause chest pain, which is why many people mistake one for the other. Not sure if what you're feeling is a heart attack or heartburn. If you belch and the symptoms go away, it probably isn't related to your heart, but to your esophagus. If you have shortness of breath or sweating, then it's likely a heart-related issue. When in doubt, check it out. If you're not sure if it's heartburn or your heart, seek medical attention right away. It's very easy to confuse the two issues, so let a doctor rule out the most severe possibility. Don't wait to get help if you experience any of these heart attack warning signs. Some heart attacks are sudden and intense, but most start slowly, with mild pain or discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes, or it may go away and then return. It can feel like uncomfortable pressure, weight, squeezing, fullness, or pain. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Shortness of breath can occur with or without chest discomfort. Other possible signs include breaking out in a cold sweat, nausea, or lightheadedness. Women's most common heart attack symptom is chest pain or discomfort. But women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea or vomiting, and back or jaw pain. The more risk factors you have, the greater the degree of risk. There are major risk factors that you cannot change, such as increasing age. The majority of people who die of coronary heart disease are 65 or older. Male gender. Men have a greater risk of heart attack than women do, and men have attacks earlier in life. Heredity. Children of parents with heart disease are more likely to develop heart disease themselves. There are risk factors you can modify, treat, or control. We already covered these risk factors when covering strokes, but they are worth repeating. Tobacco smoke, alcohol, high blood cholesterol, high blood pressure, physical inactivity, obesity and being overweight, diabetes. At least 68% of people with diabetes over 65 years of age die of some form of heart disease. Among that same group, 16% die of stroke. Individual response to stress may be a contributing factor for heart attacks. Some scientists have noted a relationship between coronary heart disease risk and stress in a person's life. For example, people under stress may overeat, start smoking, or smoke more than they otherwise would. Recognize the symptoms of stress in your life and take steps to reduce it. A heart attack can occur at any age. You're never too young to start heart-healthy living. If you're over 40, or if you have multiple risk factors, work closely with your doctor to address your risk of developing cardiovascular disease. Follow the 7 simple steps from the American Heart Association. For the first 4, work with your doctor to find out if you have healthy levels. If you don't, work with your doctor to make a plan to control them. 1. Manage blood pressure. 2. Control cholesterol. 3. Reduce blood sugar. 4. Lose weight. 5. Get active. 6. Eat better. And finally, number 7. Stop smoking. Like strokes, there are 2 categories of testing, non-invasive and invasive, to determine if you have had a heart attack. Non-invasive measure your heart's activity through external imaging and electrocardiography. Invasive testing includes drawing and testing samples of your blood and inserting and threading a thin hollow tube called a catheter into a blood vessel to get an inside view. Doctors are busy, but they really want to help you. Bring any questions you may have about your diagnosis, your treatment, or other elements of your medical care. Here are some examples of questions heart attack patients often have during the heart attack diagnosis process. What kind of heart attack did I have? Did it damage my heart permanently? Why did this happen to me? Am I at risk of having another one? Could you explain the treatments and medicines I'll need? Should I worry about how my medicines will interact or possible side effects? How long will I have to stay in the hospital? What physical limitations will I have while recovering? Will I be able to return to a normal life? What is cardiac rehab? When can I start? Treatments for a heart attack can include: a catheter with instruments can be inserted to either expand the space of your artery or clear some of the blockage. Bypass surgery treats blocked heart arteries by creating new passages for blood to flow to your heart muscle. Artificial heart valve surgery replaces an abnormal or diseased heart valve with a healthy one. Heart transplant removes a diseased heart and replaces it with a donated healthy human heart. Implantable medical devices. Pacemakers and LVADs are 2 of the common ones. They are used to regularize the heartbeats. You may have seen commercials for aspirin claiming to have a safe low dose or claiming it can save a life during a heart attack. Let's address both of these use cases. Should you take aspirin daily? If you have had a heart attack or stroke, Your doctor may want you to take a daily low dose of aspirin to help prevent another. Aspirin is part of a well-established treatment plan for patients with a history of heart attack or stroke. Always follow the treatment plans your healthcare provider has recommended for you. Should you take aspirin if you are having a heart attack? If you are having a heart attack, call 911 immediately. After you call 911, the 911 operator may recommend that you take an aspirin. He or she can make sure that you don't have an allergy to aspirin or a condition that makes using it too risky. Taking aspirin isn't advised during a stroke because not all strokes are caused by blood clots. Taking aspirin could potentially make a bleeding stroke more severe.
All right, that looks like 2 supervillains out of 2. Let's go ahead and wrap this thing up.
If you would like more information on either stroke or heart attack, visit the American Heart Association website or the CDC website. Also talk to your doctor to answer questions and to test for potential risk factors. Remember the symptoms for stroke and heart attack. React quickly and you could save a life. Congratulations, you have completed the training.
Did you see that? The part where they saved another person's life like an actual superhero? That was awesome.